Okay, now we're going to wrap this up by talking about technique. So, critical steps for producing a radiograph of diagnostic quality. We need to prepare the machine correctly. We need to make sure that all the settings are right and that the height is right and all that sort of stuff, that we have the bite stick in there, and we have everything prepared with the machine. We need to prepare the patient. We need to educate them about what's going to happen. We have to prepare them for knowing that, this thing's going to move around their head. It's going to take 20 seconds, that they have to hold really still. So, we want to make sure that we prepare the patient. Position the patient properly. That is absolutely necessary. They can't be slouched. They can't, be tilted off to the side. We've talked about where they have to bite just properly on the bite stick. Expose the film properly, and then process the film properly. Those last two are a little bit easier when you have digital, but we still want to make sure that we are familiar with all those steps. So the technique, so it's important to know what the Frankfurt plane is. This is something that we're going to talk about. You're going to hear that that term, Frankfurt plane. So we need to know pretty much two planes. We need to know the Frankfurt plane and then the mid-sagittal plane. So the mid-sagittal plane is pretty easy because it's just right down the center of their face. So that's fairly easy, but the Frankfurt plane oftentimes gets is the one that you have to remember the landmarks a little bit more. So if you can see in this picture, let me get my mouse over here. Where's my mouse? Here it is. So the Frankfurt plane is a really straight line from the upper tragus here over to, it's right underneath the orbit of the eye, and it shows better with a skull, because you can see where this line is going. But the biggest thing we'll talk about the landmarks, but the biggest thing is that this line, this Frankfurt line, is parallel to the floor. So when you have your patient bite down on the stick, you need to move their chin up and down until the Frankfurt line is parallel to the floor. That is the big key thing. So here we go. We're going to talk about, here's the tragus of the ear. And here you can see they did like a little see-through skin thing, and you can see the floor of the orbit. So from the tragus, the external auditory meatus, so it's like at the top of the tragus. So this little bump here is the tragus, so it's at the top of the tragus. So at the top of the tragus, straight across to the floor of the orbit of the eye. So that's a straight line. So that's your Frankfurt horizontal plane. Now, in the video that Director Copeland, Amy, did a couple years ago, she was talking about just under the tragus, the bottom of the tragus, straight across to the ala of the nose. And the ala of the nose is the little curvature thing here. So that line, that's what she was referring to in the video. That line also, if you're going to use that line, it has to be parallel to the floor. It has to be perfectly even. So whichever line you're looking at, whether it's this dotted line here, if you're looking at this dotted line here, or if you're looking at the true Frankfurt horizontal plane from the top of the auditory, external auditory meatus to the floor of the orbit, they have to be parallel to the floor. That's the take home. So preparing the patient, ask the patient to remove all jewelry, and really don't just say jewelry, say please remove all metal, because they might not think of, they might have plastic, like plastic earrings in or something like that, but they have a metal piece. So they might be like, oh, my earrings don't have metal. So they don't think about it. Or they might not think about their hearing aids having any metal, or they might not think about a necklace having any metal because it's kind of, lower on the neck. So basically say to your patient to please remove all metal from your head and neck. And then you can say that includes any dental appliances or hearing aids. You can expand on that depending on their age, or just if you want to have just a script that you go through with all patients. And then you take the lead apron and you're going to drape it over them with the opening to the front. So it's a little bit counterintuitive, but you want the big long part of the lead apron going down their back because the radiation is coming from behind. And then you want to make sure that you don't have it too high up on the back of their neck, or else that lead apron can show up in the pano. And then tell your patient what to expect during the procedure. Talk to them about the rotation of the pano machine and how it takes 20 seconds and how they have to hold still. And then you're going to talk to them in a little bit more. Once they get in there, you're going to talk to them more about putting the tongue on the roof of the mouth, that sort of stuff. But you don't have to say that quite yet because it's a little bit too much information too soon. So let's just go through our steps here. So here we are draping the lead apron onto our patient. The opening is in the front. This is oftentimes what's used. We have this in our clinic. The thyroid collar is not used because it would end up showing on the image, so we can't use the thyroid collar. And this is an image with a thyroid collar showing. You got some spine in there, but then this really bright white is the thyroid collar. It blocked the beam. So position the patient correctly. Anterior, posterior position. They just have to bite right into that little notch on the bite stick, and that will get them in the right anterior, posterior position. Occlusal plane, make sure that their occlusal plane is parallel, and that we have that by checking that Frankfurt plane. Midline is centered. The spine is nice and straight. Their shoulders are down, and they're kind of pulling their little neck right out of their body, just like a turtle out of its shell. And tongue to the roof of the mouth, from the front of the tongue to the back, all the way to the soft palate. Just get that tongue all the way in the roof of the mouth. Spine is straight. Ask the patient to move their feet forward so the spine will straighten. So they're going to sort of be leaning back. So since they're going to lean back a little bit, they need to hang on to the handles here, or else they're going to, feel like they're going to fall, or they will fall because they're leaning back. And then I did this little line here, this little line. So this is the bottom of the tragus of the ear, straight over to the top of the ala of the nose here, this little curvature. And see how parallel it is on her? So right down bottom of the tragus, straight to the ala of the nose, and it's parallel. So that's what you want. Position the patient correctly. Machine manufacturers try to make this as simple and as repeatable as possible. They have these lights that will show up on the patient's face so that you can get them right down the middle of their nose, and then that Frankfurt plane. And then there's these little head holders that come down kind of like at the temple or push up against the front to kind of hold their head right where you move them. And then must check details of specific machine in owner's manual. So every machine that you use might have a little difference. So when you start a new practice, you'll need a little training on whatever Pano machine they have in their office. Basic principles are always the same though for almost all machines. They just have slight variations due to the manufacturer. Okay, anterior posterior position. So here we can see the little bite block on the bite stick and the little groove there that the maxillary and mandibular incisors will fit right into this little groove. Teeth must be in the focal trough. If they're not in this section, they're not going to be in the focal trough. Patient bites in the groove of the bite pin. Mid-sagittal plane is vertical and no head rotation. So when they bite down on here, that light that will show up that kind of is your guide should be going right down the middle of their nose, mid-sagittal plane. Expose the film properly. Correct machine setting based on the patient's size. Usually you can, some machines have small, medium, large. Sometimes they have just different settings, but it's usually sort of a ballpark setting. You don't have to dial it in too specific. They usually have those kind of preset, and you just decide if it's a small adult, a large adult, a small child, a large child, those sort of things. Very patient positioning. So every patient's going to vary depending on their body type and size and shape and all that. Ask patients to swallow and put tongue on the roof of their mouth. So say when you swallow, your tongue's going to go up to the roof of your mouth. Keep it up there until the beeping stops. Caution patients to hold very still. If they move, then the x-ray is going to get distorted and we'd have to do it again. Depress the exposure button. Switch for the entire cycle. So push that button down and hold it down. If you let up on the exposure button, it's going to stop. So you have to hold it down until it beeps. And then you'll see that when we do our practice. And oh, that's it. No more. That was fast. All right.